Hi, Dan. I'm Paul. I'll be your student massage therapist today. So what I'm going to be doing today is a few neurological tests. So the first group of testing I'm going to be doing is called TOS testing. What this is going to check is to see if there are any compressions of your nerves going into your hand, with the radial pulse possibly being restricted, and I wouldn't feel it if it was positive due to compression. So different tests check for different compression spots. So the first test I'll be doing is Addison, so I'll just get you to slide a bit over for me.
Sure.
So all I get to do is just give me your hand.
Okay.
I'm just going to be feeling for your radial pulse. I'm going to bring your arm backwards, and I want you to look towards me. And I want you to breathe in for me. Okay, and you're fine. So you're not a positive sign because the pulse is still there. A positive sign would be if the pulse diminished. And this is checking for compression between anterior and middle scaling. Next test I'll be doing is costoclavicular testing, and this is where I'm going to be anchoring the shoulder and bring it back to see if the pulse diminishes. So I'm going to drop your shoulder, and I'm going to bring it back. I'm checking the pulse, and her pulse is still there, so that is not a positive sign. So once again, the positive sign would be if she feels tingling into the arm and the pulse would slowly diminish or be completely absent. And this is checking the compression between the clavicle and the first rib. The next test I'm going to be doing is Hallstatt's, which is going to be her looking the opposite way. It's similar to Addison's in terms of the positive sign, so I'll just get you to look the opposite way. I'm going to bring your arm back, and I want you to breathe in for me. And you're okay there. So the pulse is still there, so that is not a positive sign. Positive sign, once again, is a diminished pulse. Next test I'll be doing is Wright's maneuver, and that is checking, the compression of the cervical rib. This is going to be Wright's maneuver. I'm going to be bringing up the arm, and I want you to breathe in for me. And that is not a positive sign either because the pulse is still there. And once again, the positive sign is no pulse when the arm is up in the air. And this is checking for compression in pectoralis minor. Next test I'll be doing is called Allen's. I'm going to be bringing the arm up to the 90 degrees and flex the elbow at 90. I'm going to be feeling the pulse. I'm going to get you to look away and breathe in. And the pulse is still there, so you're okay. That is not a positive sign. Once again, a positive sign would be for this test is if the pulse was gone when she was looking away, but once she looked back straight normal, if the pulse returned, then that would be another positive sign, because if the pulse was gone, that would mean that there's compression. And for this test, the compression for Allen's test would be in anterior scaling. And the last test we'll be doing for TOS is, I'll just get you to bring your hands up like this for me. I'm going to get you to just repeat this motion for me. And what this test is checking for is compression in the general thoracic outlet. Positive sign would be if you find any heaviness in the arm, lack of being able to repeat this motion for 3 minutes, and you just feel basically the inability to contract and maintain this motion with feeling heaviness. So did you feel anything at all?
Yeah, a little bit actually.
You did? So she might be positive for the test because she had heaviness in her arm and she felt sensations in the arms while doing the contractions, and it was for probably 20 seconds, so that probably is a positive sign for ruse. So once again, for thoracic outlet syndrome, these just check for compression. By doing these various tests, I can see where there are compression happening if there are positive signs. The benefits for me doing these tests is to see if there is compressions, and if there is, I will be able to form my treatment plan around it to relieve surrounding structures and limit the muscle tightness that could possibly be around that and return the patient to normal. The risk might be while doing these tests, it might reoccur the symptoms that they are experiencing, and it might re-aggravate or re-show the symptoms that they've been experiencing, which could cause pain. Keep in mind the pain scale wouldn't let me go over 7. Okay? So the next test I'll be doing is for carpal tunnel. What this shows is to see if there is any compression within the forearm here, and there would be a compression of the radial nerve within the wrist and the retinaculum there. So what these tests are going to be doing is checking for compression. So the benefits would be, once again, checking if there is any compression within the area and to loosen that up for treatment. By doing this, it will allow me to form my treatment to change it to allow for better function in the wrist. Wrist might be while doing the test again. There might be pain in the following movements, which, once again, don't let me go over a 7 while doing these tests. So the first test is going to be called Phelan's. What this is going to be is I'm going to get you to do this for me. I'm going to get you to hold it for me. And do you have any pain or sensation in your wrists at all?
No.
Feel any pain? No?
No.
So that is a negative sign. A positive sign for this test would be if you felt any pain or tingliness going into the thumb and into the first finger and lateral aspect of the ring finger. Next test, once again, testing for pain and tingling and through the wrist into the fingers is reverse valence. So all you should do is just do this for me. I'm just going to get you to hold it. And do you feel any pain or discomfort within your wrists and into your fingers?
No.
No? Okay, you can put them down. So that is a negative sign as well for carpal tunnel. Once again, there would be pain tingling through the thumb into the index and lateral aspect of the ring finger. Next, I'll be checking a test called Tinel's, which is me basically tapping, which would be applying compression to the radial nerve, causing, once again, a sensation into the hand that's tingling and numbness. So what I'll get you to do is just hold out your wrist for me. I'm just going to be tapping right on the wrist here. So by doing this, it should cause a tingling sensation if it's positive. Is there any pain? No. So she doesn't feel pain. So that is, once again, a negative sign for carpal tunnel because there is no sensation of tingliness going into the hand. And you can also do it at the elbow. So I'll just get you to roll your sleeve a tiny bit. And you just got to find that little spot right near the acrolecular process on the medial side of the elbow. So it's right here. So I'm just going to tap here as well. So there should be kind of pain and tingliness going down the medial aspect of the forearm. Is there any pain with that?
No.
So there is no pain going into the medial side of the forearm, so that would be a negative sign as well. So she is not positive for carpal tunnel based on those 3 tests. Okay, so next we'll be doing tests called upper limb tension tests, which will check for compression of either the median, radial, or ulnar nerve. These tests combined will allow me to see if there is any compression down through the arm by putting the arm into different spots. And benefits of me seeing this is to allow me to check if there are compressions for the nerves that will change the sensation through whichever arm I decide to test. This will allow me to, once again, change my treatment plan to treat the surrounding structures to relieve any type of compression if I can, based on where the compression will be. Risks will be there might be pain while reenacting these compression movements because if it is compressed, it will cause a tingly sensation down the arm on either the radial side, the median side, or in the ulnar side. So I'll just get you to lie up here for me.
In the back?
Yeah.
Okay.
So the first test is checking for median nerve compression. So what this is going to involve, I'm going to be, actually I'll just get you to slide over a bit more.
Sure.
So I'm just going to be depressing the shoulder. I'll be bringing the arm out. I'm just going to be bending fingers down. And this positive sign if there is pain. If you look away from me as well too. So right here, there should be positive with tinglingness going down into the arm. So is there positive there?
Yes.
So she does feel pain, so that means that she is positive for upper limb tension test number 1 because there was a pain sensation going down into her arm when she did this test. Test number 2 is also checking for median nerve, but it is just at a lower arm angle. So I'm going to be, once again, depressing. I'm going to be extending everything, including arms, fingers, and hands. And I'll get you to look away again for me. I'm just going to be flexing and, extending the hand. Do you have any pain?
Tingling, actually.
So there is tingling, once again, down the arm as the arm is lower. So it is another positive sign for this test. This shows that the median nerve is compressed in both the first test and the second test. So the third test is checking for compression of the radial nerve. This is going to be basically the same as the tension test number 1, except the arm is going to be kind of pronated, and it's going to be brought straight out. And I'm going to be flexing your hand down, and I'm going to be radial deviating and flexing the hands while getting the patient to turn their head once again. So turn your head.
Sorry.
Do you have any pain with this?
No.
No, so that is a negative sign for the radial nerve with this test, with the arm out to the side and the arm and hand flexed, so there is no pain there and no tingliness, which means it is a negative test. And upper limb tension test number 4, the last one, is going to be checking for the ulnar nerve compression. So there once again might be pain sensation down into the arm when this test is performed. So I'm going to get you to bring your arm out to the side. I'm going to get you to bend your elbow and get your arm to bend and pretend like you're posing. And as you do this, I'm going to be extending the wrist and bringing up the shoulder. And do you feel any pain, tingling sensation when you keep your head to the opposite side?
Yes.
You feel pain, tingling?
Tingling.
Tingly? And where, just down the arm or?
Up here.
Up in the arm? Okay, so that tested positive for ulnar tingling for upper limb tension test. So from these tests, I see that the median nerve was compressed in test 1 and 2, and the ulnar nerve was compressed during test 4. Next, I'm going to be doing, I'll check for piriformis syndrome. So I'll just get you to roll over for me onto your stomach. So what these tests are going to be checking for is to see the length of the piriformis, as well as to see if she might have sciatica due to tight piriformis. With these tests, it allows me to check if the piriformis is tight, which will possibly cause sciatica in people because the sciatic nerve runs under the piriformis, which if the piriformis is tight, then it could press on the sciatic nerve, causing sciatica down the leg. The benefits of me finding out if these tests are positive or not is to allow me to form my treatment plan around piriformis and loosen up the muscles around piriformis, including piriformis, to relieve the pressure off sciatic nerve. Risk might be while doing these tests, you might feel pain or discomfort because if it is tight, then it will reoccur the symptoms that you feel for the piriformis and the sciatic nerve. So for this test first, I'm just going to get you to slide down a tiny bit more for me this way. And I'm going to get you to bend your knees up to 90 degrees. And what you're going to do when I tell you to is to just let your legs drop outward. Okay. So what I'm looking for here is to see if there's a nice proper V opening, which means that the piriformises are not tight and they're properly lengthened. So when you're ready, just let your legs drop out to the sides for me while keep your knees straight. So this is basically a proper V. There's no discrepancy on either side, which means that the piriformis is not tight on either side based on this test, which means that there wouldn't be any possible sciatic nerve compression from this test. But to double confirm, I'll bring it to the second test, so I'll just get you to line your side for me. And just slide over to the edge of the table. So what this is going to check is to see if the piriformis does compress the sciatic nerve. But since the first test that I saw, there was no shortness in the piriformis, there shouldn't be a positive test. But a positive test would be when I push down on her leg, there should be pain running down her leg because the sciatic nerve would be compressed, cause reoccurring sciatica symptoms. So keep your bottom leg straight. I'm going to bring your upper leg up, and I'm just going to be stabilizing the hip. And just slide over a bit more for me. I'm just going to stabilize the hip and push down on her leg. Do you have any pain or discomfort coming down your leg?
No. Okay.
No? So that would be a negative sign, as I kind of hypothesized before this test, because there was no length difference and they were loose. So positive sign would be feeling pain and tingliness coming down the back of the leg, because if the piriformis was tight, it would cause sciatic symptoms, but she is negative. The next test I'm going to be doing is checking the median nerve in the hand, so I'll just get you to sit up for me. And what this is going to involve is I'm just going to get you to try and touch your fingers at the very fingertips here. And this is just checking for if the median nerve is not compressed, because if not, then the pads of your fingers would be the only things that would be able to connect. But if you can precisely touch the tips of your fingers, then that shows that your median nerve is not affected. So I'll see if you can just get right at the fingertips there. So she is getting exact fingertips, so that is a negative sign for this test, and it shows that her median nerve is not affected. Next is going to be the grip test. So what this is going to check is to see if she can hold onto a piece of paper without letting go of her grip, which would show that the nerve is allowing the muscles in the hand to maintain a proper grip. So a positive sign would be if you're trying to grab and I just be able to pull it out with not a problem. And a negative sign would be if you can actually stabilize and hold on. So I'll just get you to hold the paper just with your middle finger and thumb. And if I pull and it comes loose, it's a negative, it's positive. So just hold on if you can. Any pain or discomfort with that? So she was able to maintain a strong grip. which means that it is a negative sign, sorry. The other test I'm going to check is for the femoral nerve. So what I'm going to get you to do is lie on your side again for me. Sorry for bringing in all these positions.
That's alright.
So what this is going to check is to see if the femoral nerve at the front here is aggravated. What this is going to check, I'm going to bring her leg back, and if it is positive, there will be pain and discomfort coming down the anterior aspect of her thigh. So I'm going to grab her leg, I'm going to bring it up a bit, and I'm going to bring it back. Do you have any pain or discomfort coming into your thigh here?
No.
No? So she is negative because there was no pain coming here because I was kind of putting pressure on the femoral nerve coming through the leg, but it was a negative test. And the other test that I'm going to be checking is for the femoral nerve as well, and just checking to see if there is discomfort coming through the lumbar spine and down into L2, L3 region. So this is just going to check her extensibility in her quads as she brings her legs up. I'm going to just passively bring her and see if she can touch her glutes with her knee, which would show that she has full flexibility and that there was no compression. If it was a positive sign, she would feel pain coming from basically lumbar into the back of her leg around L2 and L3. So I'm going to passively bring your leg back, just stay nice and relaxed. And her heel touches her glute, and is there any pain or any sensation coming through here?
No pain or sensation.
So that's a negative sign because there was no altered sensation here. Let's double check on the other side just to confirm. It should be the same thing, so I'm passively bringing her knee back to her glute, and it touches once again. And is there any pain or discomfort in the lumbar?
No.
No, so there's no discomfort in the lumbar spine or into L2, L3, so that is a negative sign for another femoral test.